Hello! Welcome to our teaching video about how to manage your diagnosis of mild preeclampsia. This video has been created to teach pregnant patients who have been diagnosed with mild preeclampsia how to manage their condition at home on a daily basis. During the teaching video, we will also help you identify when your condition is worsening and when you should contact a provider. Mild preeclampsia is a medical diagnosis that will be identified by your doctor. Preeclampsia is defined as a serious hypertensive disorder during pregnancy. This video will focus on the management of mild preeclampsia. Mild preeclampsia is defined as your blood pressure being greater than 140/90, systolic of 140 and/or diastolic equal or greater than 90. This usually occurs after the 20th week of your pregnancy. It is also identified as having protein in your urine with a result of 1+. If you have been diagnosed with mild preeclampsia, your healthcare provider has most likely outlined specific interventions on how to care for your condition by yourself at home. These interventions include taking a daily weight, monitoring your blood pressure throughout the day, performing fetal kick counts, maintaining modified bed rest in the left lateral recumbent position, and maintaining a well-balanced diet with a focus on high protein and high water consumption. During the following clips, we will emphasize how to properly perform each intervention to care for yourself correctly. How to correctly take a daily weight. Use the same scale each day and make sure it is calibrated correctly. Be sure to weigh yourself at the same time each day, ideally before breakfast in the morning. Empty your bladder before stepping on the scale. And remember to wear similar lightweight clothing each day or weigh yourself naked. What's wrong with this picture? I think that kitty cat would tip the scale a bit, don't you think? Remember, extra clothes, accessories, and furry friends can add extra pounds and provide an incorrect reading. So remember, the more controlled and accurate your readings are, the better management you have on your condition. Most importantly, contact your doctor immediately if you have sudden weight gain or experience excess swelling. Another intervention that will be ordered by your doctor is modified bed rest. Bed rest promotes relaxation, lowers your blood pressure, reduces stress, and prevents your condition from worsening. You'll want to find a bed and/or a recliner that is comfortable for you and settle in.
Honey!
While it is recommended that you remain in bed as much as possible, you are not completely restricted to your bed. You may still get up to go to the bathroom, to shower, eat meals, and attend doctor visits. You've most likely been told to rest in the left lateral recumbent position. But you're probably wondering, what does it mean? How do I do it? Here you see this mother is properly positioned on her left side with a pillow resting in between her knees and a pillow propped behind her back. Doesn't that position look like a pregnant woman's dream? The purpose of resting in this position is to improve blood flow to your baby. This position also reduces your blood pressure, promotes relaxation, and enhances urine production to relieve fluid retention. Obviously, these are no-nos. Put your loved ones to work. Bed rest can leave people feeling lonely, isolated, and depressed, especially for people who are very social and active before their pregnancy or diagnosis of mild preeclampsia. Reach out to your support group and let them know you'll be on bed rest. Encourage friends and family to visit. If you feel that remaining on bed rest is becoming unmanageable or you are feeling more emotional than normal, be sure to contact your provider for help. The next important daily intervention to manage your condition is monitoring your blood pressure. Your healthcare provider may teach you and/or a caregiver how to check your blood pressure at home using a manual blood pressure cuff and a stethoscope. There are also electronic blood pressure monitors available for purchase at your local pharmacy, which may be easier for self-individual monitoring. Be sure to monitor your blood pressure every 4 to 6 hours at home. You will want to assess for a change in trends or any abnormal increase in readings. Be sure to measure your blood pressure on the same arm and in the same position each time. Make sure the cuff is placed snugly on the arm and is appropriate for your size. Be sure to have both feet flat on the floor and uncross your legs. Do not take the blood pressure when the arm is above or too far below the heart, as this will provide a false reading. If you've been active, you'll want to wait 30 minutes before you do a reading. And again, if you see a change in the trend of your blood pressure results, report these findings to your doctor immediately. Now, we will emphasize the importance of monitoring your fetal well-being. Start by finding a comfortable position during a time when your baby is usually most active. Some moms prefer sitting in a well-supported position with their arms holding their bellies. It's important to time how long it takes you to feel 10 kicks, flutters, swishes, or rolls. Ideally, you want to feel at least 10 movements within 2 hours. In a notebook, record your findings and assess for changes in trends. This will help you observe patterns and discover how long it normally takes for your baby to move. It can become easy to expect an exact amount of time every time you do your kick counts. However, there can be a wide range of time differences. So remember to look for significant deviations from the pattern over the course of a few days. Contact your doctor to be evaluated if there is a decrease in movement. Overall, maintaining a well-balanced nutritional diet is of great importance for you and your baby's health. Your doctor will prescribe a diet high in protein and high water consumption. Good sources of protein during pregnancy include beans, peas, eggs, soy products, nuts, seeds, lean meat, seafood, yogurt, milk, and cheese. Hydration is also critical at this time. It is recommended that you consume at least 6 to 8 8-ounce glasses of pure water each day. This does not include sodas, juice, or sports drinks. And remember, don't skip the salt. In conclusion, this slide outlines signs and symptoms for when you should contact a healthcare provider and that your condition is worsening. Keep in mind that just one of the listed symptoms mentioned indicate that you need to see your doctor. Have your blood pressure readings gradually or abruptly increased? Are you feeling more muscle tension or have jerking motions occurring in your hands or feet? Do you have increased swelling in your arms, legs, hands, feet, or face? Are you going to the bathroom as much as usual, maybe more or maybe much less? Are you experiencing blurry vision or seeing spots? Do you feel confused or have a headache that won't go away? Do you have a new onset of abdominal pain? Your hands and feet feeling tingly? Are you experiencing less fetal movement? If any of these symptoms are occurring, contact your doctor or report to a healthcare facility immediately, as this may indicate that your condition is worsening. Remember to attend all of your scheduled doctor visits, as this allows for your healthcare provider to monitor your well-being and provide appropriate care to keep you and your baby safe. Thank you for taking this time to listen to this teaching video on management of mild preeclampsia at home on a daily basis. We hope this has been beneficial to you.